Hello, everyone. Welcome all of you to join our virtual conference, our family members, patients, and all related personnel. Especially thanks for your kind introduction, Professor Lee. I got my position in 2020 after the previous Professor Choi, director, was retired. But unfortunately, in the middle of COVID-19 situation, I got this position. So we got a lot of changes and facing a lot of difficulties. However, I want to introduce the role of International Healthcare Center of our hospital, and also want a brief introduction of Seoul National University Bundang Hospital. So my title of talk is Home Away from Home. The first part is about our university history and also the brief introduction of our hospital. Seoul National University College of Medicine was established in 1885 and started its national hospital in 1907. But also in the name of Seoul National University Hospital in 1978, and Seoul National University Bundang Hospital is one of the important branch-affiliated hospital launched in 2003. This is our hospital. And then we have many distinctive features of our hospital, especially our hospital is paperless hospital, the all electronic medical records, and a fully digitalized hospital. So we got a very high levels of accreditation from our government. And in 2013, we have new wings. This new wings is especially for patients with cancer and also neurological diseases and a neurosurgery department. And the innovative, the development of our hospital is we merged the big research center in 2016, which is Healthcare Innovation Park. And there is a lot of companies and fully digitalized animal facilities and also wet and dry benches for research center. So this is currently the picture of our hospital. So this is our main building and new wings for the cancer and neurological patients. And also, as I mentioned, this HIP, which merged in 2016, there was the Healthcare Innovation Park. So those kind of three units are very well connected and very help to each other. So not only for the patient consultation, but also for the research results as well. So I'm very proud to have those kind of very innovative and well-connected facilities. And a very brief picture of our hospital is tertiary teaching hospital. And there's a lot of internship and residency people, and also all related personnel are under training. And also big emergency center. And our hospital is national hospital. So we have more than 5,000 employees and also more than 1,300 beds and a 40 operation room. And especially we have a very distinctive feature for the outcome. So there is many good things, but we are operating at least 200 cases per day, which is very big and which is up to 5 big hospitals in our country. So in this special situation, so because we have strictly followed the protocol of COVID-19 pandemic situation, so very stringent method for the entrance and exit and everything. So we check up everything by QR code and also temperature checkup and the questionnaire, but also the D-level protection for the medical personnel to contact the COVID-19 patients. So we are very well organized and follow the efficient protocol, the digitalized protocol for COVID-19 pandemic situation. The second part is about our International Healthcare Center. So International Healthcare Center is located in the main building, the third floor, which is here. So actually that was my room. So I have a beautiful window, so I can see the outside. So in the building one is the main building, and located at the third floor, you can easily come up to our center. And about the manpower, because I'm so proud of our team, so we have 4 doctors and maybe 1 fellow will be start from next year. And we have nurses and coordinators, especially 2 Arabic, 2 Russian. There are our resident coordinators, and also 2 specialist nurses for English-speaking people. And 2 administration helpers are working at our center. As you can see here, actually there's my previous director, Professor Choi, is now in Chicago, and he retired after his devotion for the National Healthcare Center. And there's the pictures. We are walking through the walking gallery between the main building and the HIP. There was some kind of a media program to broadcast our system. And I proudly want to say that our hospital in the National Healthcare Center is the first hospital IHC to get the global healthcare accreditation in South Korea, actually. So GHA accreditation means our medical services at the standard care levels of a global standards. So I'm very proud of, and everybody had a very big effort to get this GHA accreditation in 2019. So what International Healthcare Center does, we have many pre-visit questions. So there's a lot of questions that I can come to your hospital and I have this problem and I can get surgery, or I can see the doctors and who is the specialist, especially famous for these diseases. And that kind of pre-visit consultation are all done in our center. And there's some kind of consultation is very easy question, but sometimes needs a professional consultation with a specialist. In that kind of cases, we have some kind of charge for those kind of consultation. And we also had a concierge. So if you want to come to our center, we can organize the hotel, like accommodations and the transportation from the airport, and the kind of things are all arranged in our concierge. And also in the hospital visit, we can actually guide you to the every center, the primary or second specialized centers, and all the processes going on inside the hospital. Everything was in charge in our center. And also in these days, everybody had a difficulties to come to direct visit of our hospital. So there is a lot of online consultation has been required. So we did a lot of online consultation with Mongolia, with Russia, and many other countries. So I think maybe after COVID pandemic situation, those kind of online consultation could be some kind of stream of international healthcare in our hospital. So we started, and we did a very good result. Even those kind of computer-based face-to-face consultation, but there's a lot of satisfaction survey is very good. So I hope many people who could not come to the hospital can do the online consultation by our system. And also we have very active collaboration with the US military. So there is actually a shuttle bus in Camp Humphrey, Pyeongtaek, and also the Air Force Osan Air Bases. So we have regular shuttle bus from there. So many U.S. military people visiting our hospital in these days. And also we have a very efficient emergency contact protocol. So there's English-speaking coordinators and also Arabic-speaking and Russian-speaking. We have those kind of contact point and a 24/7 every day. So and then maybe we have we follow the what is the problem, and we contact the specialist, and we arranged everything for emergency care, or sometimes admission, or sometimes outpatient clinic visit. So we have very efficient, organized protocol for the contact. So actually, this is my last slide. So we want to make you feel like you're second home in Korea. So under the management of Nurse Peck, who is the manager of our center, and also the very big help from Deputy Professor, Professor Lee, who are going to deliver more detail about our hospital situation later. And many patients had a nice thanking messages from everywhere. And I think definitely our system can help you to feel like you're second home in our center and also in Korea. And as I mentioned, our medical services, not only for the hospitality, but also for the medical services, are world standard level to get GHE accreditation. So hope, please come to our center and the experience our medical services in the Seoul National University Bundang Hospital. Thank you and welcome all of you. Thank you very much.